Good evening, everyone, and I'm starting this session, which is the last session of this workshop, Let's Talk Women's Health. This is my initiative, and this is based on the concept of 4 E's, that is, empowering and enlightening women through education and e consultation. So, today we shall be talking about cesarean birth versus natural childbirth. And I would be telling you in brief about what exactly is cesarean birth, what exactly is natural childbirth, what are the benefits, advantages, disadvantages of both. And towards the end of the session, we can have a Q&A wherein you can ask me if there are any doubts or if there are any queries involved. So we'll talk about normal labor, mechanism, how does normal labor occur, what are the benefits, what are the risks, then the cesarean birth, the indications, risks and benefits. So the natural childbirth or the childbirth through vaginal route, this is actually a miracle of nature because how the baby comes out is actually has been designed by God in such a way, and it's actually a miracle to watch. And every time the woman, she's in labor, she's having pain, she might be in a lot of pain, but as soon as the baby is born, the smile on the baby's face, it makes the life worth living. And that is something when she sees her newborn baby, and this I've observed so many times, the lady may be in so much pain, but as soon as the baby is born and she sees the baby's face, everything is lost. I mean, all pain, all agony, all suffering, and you can see happiness on her face even though she is undergoing maybe stitching of a wound or something, but still you can see the smile. So birth of a baby is associated with so much joy that nothing is actually comparable to that. So just to tell you exactly what happens during labor या क्या होता है. So this is basically a diagram which is showing the uterus या गर्भाशय या womb, and the baby usually lies, baby's head is downwards. So you can see this is the normally how in majority of cases the baby's position will be, and the legs are upwards, so you can see it here. And this is the womb or the uterus, garbhashya, and this part is the cervix. Cervix is in Hindi you call it as bachchetani ka muh, the neck of the uterus. And what happens is, and this is the vagina, and towards as the labor progresses, this ये जो birth canal है, the cervix, this starts opening up. ये धीरे धीरे खुलने लगता है, and जब ये पूरी तरह से खुल जाता है and इसकी walls बिल्कुल paper thin हो जाती है, that is the time when we call the cervix as fully dilated and fully effaced. That is, the cervix becomes paper thin and it becomes almost 10 centimeters. So that is the first stage of labor. And this process, it may take a little time. So the baby is connected with the placenta through this umbilical cord. And this umbilical cord, after the baby is, this is the connection between the mother and the baby. This is the umbilical cord. And this is the most common position, that the baby is head downwards. And the labor is like what we medically say, that it comprises of 3 stages: first stage, second stage and the third stage. So what are these stages? Now I'll tell you. The first stage of labor, this is, you can see, this is known as the cervix, or this is the neck of the womb, or this is the birth canal, or janam nali, the cervix. ये in the beginning, before during the pregnancy, this is completely closed. ये आपको दिख रहा होगा, ये बिल्कुल बंद है इसका मुंह. But as the labor starts and the woman starts having uterine contractions, this is the time this starts, ये धीरे धीरे खुलने लगता है. The cervix starts gradually opening up and it starts, the walls also start becoming thinner and thinner. अभी तो यहाँ पे thick walls हैं, ये धीरे धीरे खुलने लगता है और ये thin हो जाता है. So that is the first stage. जब ये पूरी तरह से खुल जाता है, इसका मुंह, जन्म नली का मुंह जब पूरी तरह से खुल जाता है, it's about 10 centimeters dilated at that time, और उसकी wall almost paper thin हो जाती है, then we say that the first stage is over. Then starts the second stage of labor. So this is just to show, this is the magnified view just to show you the whole thing, how the baby is placed. This is the placenta, this is the umbilical cord, and this is the head, and this you can see here, this is the cervix. You can see this is completely closed, and slowly and gradually it starts dilating or it starts opening up. Now I told you that the head presentation or the cephalic presentation, when the baby's head is presenting down, that is the most common position. But sometimes in some ladies, instead of the head presenting down, it could be the baby's limbs, baby's legs, or baby's buttocks presenting. So this is the breech presentation. जब baby के पैर या legs are presenting or buttocks are presenting, that is breech. So some cases breech presentation may be there. Sometimes instead of legs and buttocks, it's the shoulder and the hand which is presenting, and that is known as the shoulder presentation, like you can see here, or the transverse presentation. In a head presentation, a normal vaginal delivery is possible in most of the cases, unless the baby का size बहुत बड़ा है and the baby cannot negotiate through the birth canal. Otherwise, in majority of cases with head presentation, normal vaginal birth would be possible. With a breech presentation, vaginal birth is possible, but majority of doctors, they don't take the risk because this may result in injury to the baby. So majority of cases, a cesarean section is done if there is a breech presentation. With a shoulder presentation or with a transverse presentation, there is no mechanism of labor. The baby cannot deliver normally through vaginal route if the baby is presenting by its shoulder. And in this case, in any case, you have to do a cesarean section. So just to give you a brief idea about what are the signs of labor. Signs of labor, एक तो मैंने आपको बताया that the cervix, when there is onset of labor or when the labor starts, the cervix, it starts धीरे धीरे dilating or opening up. The second thing which happens is there is production of blood stain discharge, जिसको हम कहते हैं show. And third thing which happens is rupture of membranes. So what is exactly this rupture of membranes? So you can see when the baby is inside the womb, it is surrounded by this bluish, आपको दिख रहा होगा ये bluish एक झिल्ली की तरह होता है. This is like a sac. It surrounds the baby and this is known as the amniotic sac. और इसके अंदर there is a fluid which surrounds the baby and that is the amniotic fluid. So when the labor starts, ये धीरे धीरे जब ये खुलने लगेगा तो ये जो झिल्ली है ये बाहर आ जाएगी. If you can imagine. So धीरे धीरे as the baby is also moving downwards, एक point पे this ruptures, the membranes they rupture, and this is what is known as the rupture of membranes. And because when the membranes rupture, ये सारा fluid जो है ये बाहर आ जाएगा. So the women may experience sudden gush of fluid. So if you experience sudden gush of clear fluid, even if labor pains have not started, then that is signifying that your labor is about to start or it has probably started, and you will very soon start experiencing labor pains, and this is the time when you should start moving to the hospital या जहाँ पे भी आपने अपनी डिलीवरी करा. So this is just to give you an idea कि cervix या जो birth canal है, it is closed, tightly closed in the beginning, and धीरे धीरे it starts opening up, and this is when it has become fully dilated or 10 centimeters or it is completely open. So this is how the baby comes out. You can see this is the cervix. It has almost, you can see here it is almost now open. Thoda sa, and as the cervix opens with the contractions, what happens is the mother या आपको the doctor will tell you to push. So the baby moves out of this passage, and you can see with as the mother pushes, the baby's head has emerged out further, and eventually when the complete, so this is how it happens, that initially thoda sa part of the baby's head you can see coming out, then as the mother applies more and more force, with uterine contraction, क्योंकि जैसे जैसे contractions the uterus is contracting, the labor pains में pain इसीलिए होता है because the uterus is contracting and it is trying to push the baby out, and at the same time you are also applying force to push the baby out. So gradually and slowly the baby is coming out through its head, and this is how it appears. So you can see the baby's face emerging out, and the complete face has come out completely. So this is a small video, you will see a very small video how the baby's head is moving down. And with the further as uterine contractions occur, the baby will come out completely. So this is the baby's head has come out completely, and this is the time when your doctor or your midwife or your obstetrician will take the delivery of the babies at that time. So this is the doctor taking the delivery of the head. So head is born, and followed by this, the shoulders they come out, and then the rest of the body also comes out. So you can see here. So this is the second stage of labor when the whole baby has come out. Starting from the neck of the womb being completely open to the complete delivery of the baby. So now you'll see that the baby is been delivered out, and this is the umbilical cord. So this is cut, and the placenta it remains inside. So after the delivery of the baby, एक बार baby की delivery हो गई and placenta is inside, then starts the third stage of labor. That is also very important because sometimes some ladies may experience severe bleeding during this stage, and this may be at times even life threatening. So one has to be very careful during this stage also. So third stage is the delivery of the placenta. So once the baby has been delivered out, the next stage is delivery of the placenta, which is the third stage of labor, and this lasts for about not more than half an hour. And once the placenta has been delivered, then the baby is given to the mother and baby is shifted to the ward. The mother and the baby are shifted to the ward. So what are the benefits of natural childbirth or the normal vaginal delivery? Normal vaginal delivery may be associated with some benefit. So the first benefit is that it is associated with shorter duration of hospital stay. Obviously, if cesarean section hoga, that is a major surgery, so that will take more time. And the time which is required for you to stay in the hospital would be more in that case. So at least आपको 3-4 दिन hospital में रखा जाएगा. But with a normal vaginal delivery, maybe it's even possible that you deliver in the morning and you are discharged by evening. In many hospitals, they don't keep you nowadays more than 6 to 8 hours. Some places they may keep you for 1 to 2 days, but that's it. Unless you have any complications, if everything is fine, then you are very quickly discharged home. So recovery is also quick because after childbirth, सारे जो आपके organs, uterus, cervix, ये सब जो इनमें जो changes आए थे, they come back to their normal pre-pregnancy stage. So that recovery is also quicker after natural childbirth. Also, this helps in avoiding risks which are associated with cesarean birth. Cesarean birth is a major surgery, so it may be associated with infections, complications like severe bleeding, because during the surgery it is possible that some blood vessel is ruptured and there might be severe bleeding. Also, because cesarean section is a major surgery, anesthesia is also given, so women may experience anesthetic reactions. Plus, there is a permanent scar which is formed in the uterus, because एक incision दिया जाएगा आपके uterus के ऊपर, which later develops into a scar once the baby is born. So forever, for your life, you turn high risk after having a cesarean birth. Another important benefit of natural childbirth is because immediately after baby's birth, you are fine. Maybe because no anesthesia has been given, so the baby can be handed over to you very quickly. So quick reunion with the baby. Again, this helps. This helps in facilitating better bonding between the mother and the baby, and also helps in facilitating early breastfeeding. So women who deliver naturally or through vaginal route, they are likely to have fewer problems with breastfeeding in comparison to those who give birth through cesarean delivery, because in those women, chances of uh, failed breastfeeding, yeah, difficulty in breastfeeding, they are more. Other benefits of natural childbirth: lower risk of respiratory problems, because usually normal vaginal delivery will take place around 39 to 40 weeks. So in the beginning, before 37 weeks, baby's lungs may not be developed properly. And there is a protein called surfactant which is produced by the lungs, which helps in expansion of the lungs once the baby is born. And this may not be there if a cesarean delivery is done before 37 weeks. The surfactant might not be produced, and as a result, the baby is likely to suffer from more respiratory problems in comparison to the baby born by natural normal vaginal delivery. Better immunity, because जो मदर के बैक्टीरिया होते हैं in the birthing canal, they will be transferred to the baby, and as a result, some immunity from the mother gets transferred to the baby when the baby is born via the vaginal route, and as a result, the baby is likely to deal with infections in a better way. Also, this is associated with lower cost, because the mother is likely to be discharged from the hospital sooner. But like everything else, nothing is just associated with benefits. There are also some disadvantages. So risks of natural childbirth, the main problem is injury to the pelvic muscles and the anal sphincters. So when the baby is born by the vaginal route, you can see that as the baby is emerging out, sometimes जो आसपास के muscles या tissues होते हैं, if mother applies too much force या baby का size बहुत बड़ा है, so sometimes आसपास के muscles, they might get slightly torn or slightly injured. Like you can see here, the muscles are getting torn. With medical advancements, it is these अगर injuries भी होती हैं तो these are repaired. And also sometimes in order to protect, so this region is known as the perineum. So if in order to protect the perineum from injury, sometimes what the doctor may do is give a cut in the perineal region, and that is known as an episiotomy. So usually an incision which is known as episiotomy is given, and if you do certain kind of exercises during your antenatal period, तब आप अपनी मसल्स को ऐसे ट्रेन कर सकते हैं या फ्लेक्सिबल बना सकते हैं, so that you don't require the administration of this episiotomy. Episiotomy is an incision which can be given like this or it can be given like this. इसकी वजह से आप देख सकते हैं कि अगर ये कट दिया जाएगा, so obviously the birth passage का size बड़ा हो जाएगा, so the risk of injury at the time of birth, it reduces. But the thing is, there's an incision which is given, so later it may take time for healing and it may result in perineal pain. This region is known as the perineum. So यहाँ पे following the baby's birth, you may experience pain in this region, pain, itching sensation, heaviness here in this region. And again, one of the best ways to deal with this is seeds bath. Seeds bath basically means seeds bath are also available from a chemist and they can be put on your toilet seat. It's basically कि गर्म पानी से सेक करना. That is what is a seeds bath. So आप एक घर में भी चिलमची में पानी गर्म करके उसके you can take help of that to give steam to this area, और सिकाई कर सकते हैं, या seeds baths are available in the market. They can be put over the toilet seat and you can sit over that. So that provides this thing, healing to this area. So coming to cesarean birth, I told you it's a major surgery in which a cut is administered over the abdomen and uterus after 28 weeks of gestation. Why we take 28 weeks of gestation? Because usually baby becomes viable after 20 weeks. But after 28 weeks of pregnancy, majority of nurseries in majority of hospitals are able to save a baby after 28 weeks. 20 weeks baby usually will not survive. So that is why usually a cesarean section means an incision is given in the uterus after 28 weeks to deliver the baby. And incision usually यहाँ पे दिया जाता है. This is after healing. This is how the incision appears. And usually cesarean surgery is basically a major surgery. So incision is given over the skin, and then after that several layers of skin are cut, and then you reach the uterus. Uterus में भी ऐसा incision दिया जाता है. कभी कभी they might have to give a vertical incision, which is rare, but usually इस तरह का horizontal incision uterus पे दिया जाता है, through which the baby is delivered. I'll show you how that happens. So cesarean delivery can be done. It can be of basically three types. Cesarean delivery, I would appreciate this procedure because this is an emergency life-saving procedure. So sometimes it is done as an emergency to save either the life of the mother or the life of the baby. Sometimes in some cases, जैसे मैंने आपको पहले बताया था कि there are some conditions, some baby's position, baby may be presenting by its legs, or baby may be presenting by its shoulders. So if breech presentation is there, or if transverse presentation is there, wherein the baby is presenting by the shoulder or the baby is presenting by its breech, in those cases a cesarean section is usually done. And since the doctor, we get to know about it maybe in the early stages of pregnancy itself. So maybe by 36 weeks or 35 weeks, the doctor will know that the baby is in breech or in transverse. And in those cases, we can post the mother for cesarean section, that is known as an elective cesarean section. So we decide from beforehand कि हाँ इसमें cesarean section ही होना है, and you give the date that okay, is this, then the cesarean surgery can be done. And there is a third type of cesarean section which is done on maternal request. Sometimes, आजकल especially, lots of ladies, they are scared of normal vaginal delivery, especially young ladies, and they might have heard some kind of horror stories from their friends or relatives कि बहुत दर्द होता है, it is terrible, so they may come for a cesarean delivery. I myself do not encourage this indication for cesarean delivery, but doctors do cesarean section on maternal request. I mean, अगर बिल्कुल ही circumstances are out of control and mother is really apprehensive and she doesn't want to get a normal vaginal delivery at any cost, then the doctor can perform cesarean delivery on maternal request. But again, I don't encourage this because you turn high risk for all your future pregnancies. So I discussed this, that emergency, it is done as an emergency life-saving procedure. Elective cesarean delivery is done when we know in advance that there is an indication for which, the lady would require cesarean delivery because probably the position of the baby is such, or maybe the baby's size is so big that it appears unlikely that the baby would be born by the normal vaginal route, or the mother requests for a cesarean. So again, this is a small video clip which will show you. Okay, so you can see a cut is given in the uterus. So instead of being born through the normal vaginal route, it's similarly in the normal vaginal delivery, the birth passages were opening up. I showed you. And here, instead of the birth passages opening up, a cut is given in the uterus, and again the baby's head delivers first, so you can see the surgeon's hand delivering the baby's head, and then you can see in the next clip how after the head, so the head is delivered out, you can see, and this is followed by the delivery of the rest of the head delivered, followed by the shoulders, and then the rest of the baby is delivered, and subsequently the umbilical cord is cut. So the process remains the same in comparison to the normal vaginal delivery. It's just that the route, there it is through the vaginal route, and here it is through a cut which is given in the uterus. So again, even though I do not encourage cesarean birth unless it is performed for a life-saving procedure or unless it is performed for an indication where there is no other option. For the mother's safety or the baby's safety, if the cesarean birth is performed, that is absolutely fine. So, what are the benefits of cesarean birth? One, it's a more convenient option. Obviously, it is more convenient, it is more predictable, it is associated with lesser pain during the procedure because you are under the effect of anesthesia. But following the surgery, because it is a major surgery, once the effect of anesthesia wears out, you may feel more pain. It helps in avoiding long, painful labor. It can be a life saving procedure. So, again, it is an emergency life saving procedure to save the life of the mother or baby. So, especially if you feel that the mother's life or the baby's life is in danger, then the best way to save them is through a cesarean delivery. Also, cesarean birth helps in avoiding the passage of infection. So, especially if the woman is suffering from some kind of infection such as HIV or there is genital herpes or something like that, then to avoid passing this infection to the baby, the best way is to go ahead with a cesarean route. So, this may be the only alternative in some special situations. For example, which we discussed, that macrosomia means the baby is a very big sized baby, and baby you don't think this is 3.5 kg या 4 kg weight है baby का. So you know that vaginal delivery may be difficult. It may result in lots of injury to the mother. So we prefer to go ahead with a cesarean route. या fetal malpresentation, जो मैंने आपको पहले बताया कि there could be the baby presenting by its buttocks or legs, or the baby presenting by its shoulders. So in those cases, again, cesarean birth is a better option. So risks of cesarean birth, because it is a major surgery, obviously there are lots of risks associated with it. During the surgery, there can be injury to the intestines or to the bladder because incision दिया जा रहा है uterus में, abdominal layers में. So there is a possibility of injury to the surrounding structures also. And since it is a major surgery, the duration of hospital stay becomes longer, and the women may be required to stay in the hospital for 3 to 4 days, or sometimes if there is some complication, even for a week or longer. Again, once anesthesia, एक बार anesthesia का effect खत्म हो जाता है, then she may feel complaints such as pain. They might be later on, sometimes there also may be infection at the incision site. There is an increased risk of blood loss because it is a major surgery. Sometimes the blood vessel may be injured, or something else, some other structure may be injured, which may result in considerable blood loss during the surgery. Other risks include that since after the surgery, mother would be under the effect of anesthesia, so she'll be kept in the post-op ward, and the baby may not be given to her immediately after the birth unless mother becomes conscious, which may take some time. It may take 12 to 24 hours for the mother to become completely conscious and to breastfeed her baby. Until that time, the baby may be kept in the nursery. So the chances of early breastfeeding, they are again reduced, and women who undergo cesarean birth, they are likely to face more difficulty with breastfeeding in comparison to those women who undergo normal vaginal birth. So again, breastfeeding is associated with its own benefits. Breastfeeding is likely to, breast milk is sufficient for the baby to provide it all the nutrients, all the calories. For the first 6 months of life, exclusive breastfeeding takes care of all the nutrient requirements for the baby. Also, it is a very rich source of immunoglobulins. So, immunoglobulins are basically passed from the mother. They provide immunity to the baby. So, baby gets immunoglobulins from the mother, and this helps the baby to fight against several infections. So that is one of the most important advantage of breastfeeding. Also, it helps in building a bond between the mother and the baby. So all these benefits of breastfeeding may be lost if early breastfeeding is not initiated, because at a later stage breastfeeding may become slightly more difficult. Also, once she undergoes cesarean section in one pregnancy, for the subsequent deliveries, it's not that she cannot have a normal vaginal delivery, but she becomes high risk, and even with a little complication, there may be a requirement of cesarean section in subsequent deliveries. So she becomes high risk, and there is a chance that the scar, even though the chances of the previous scar, the incision which was given on the uterus, to rupture is very very low, but still the chances are there कि subsequent pregnancy में वो जो पिछली pregnancy में cesarean section का scar दिया था, that may rupture. The chances are very low, but if it does occur, that is a life-threatening emergency situation. And again, that's because it's a major surgery. So, जहाँ तक हो सकता है, that should be avoided. Then there's another complications which can occur with cesarean delivery, which are known as placenta previa and placenta accreta. So, which I'll tell you what these are. So once a woman has undergone cesarean surgery, in the subsequent pregnancies, there is a risk, there is a higher risk of developing placental abnormalities such as placenta previa and placenta accreta. What are these things? Okay, like I showed you in the beginning, I showed you that this is how normally the placenta is. This is how the baby is. This is the uterus, this is the umbilical cord, this is the cervix or the birth canal, and the baby's head is usually downwards and the placenta is usually upwards, placed here. Sometimes it may also be placed on the walls of the uterus, the side walls, so it may be here or it may be here. But usually in majority of cases it is upwards. Now, placenta previa is a condition where instead of its placement in the upper segment, it is placed here below the baby's head. So that is a complication, and which is known as placenta previa, and this may be the cause of recurring bleeding during the pregnancy itself. So some women, they may experience some episodes of bleeding throughout their pregnancy, and this is a condition which is because the placenta is present down below. And why this is a dangerous situation, because imagine if placenta is present here and the birth canal starts opening up, and placenta is here. Placenta has all the blood vessels from the mother, so bleeding will occur. So there are chances of excessive hemorrhage occurring if there is a situation called placenta previa, and the chances of placenta previa, they become more if you've had a previous cesarean section. So this is what happens in placenta previa, that I told you the placenta is present here down below. So when the birth canal it starts opening, यहाँ से hemorrhage, यहाँ से bleeding होने के chances होते हैं, and sometimes the hemorrhage may be so bad that it may be at times even life-threatening. So, and the chances of developing this condition increase if you've had a previous cesarean section. There's another placental abnormality which can occur if you've had a previous cesarean section, which is known as placenta accreta. Placenta accreta का मतलब ये होता है कि placenta is not, normally what happens is after the baby is delivered, the placenta is also delivered completely. But if placenta is abnormally attached to the wall of the womb or to the wall of the uterus, it may not come out completely, and some placental bits may remain inside, and these may act as source of continuous bleeding later on. This is a condition which is known as placenta accreta, and again the chances of having this condition, they increase if you've had a previous cesarean section. So again, like I told you, that I am a supporter of natural childbirth unless there are definite indications, maternal or fetal, for cesarean birth. So that was all in this session. So if now I have any questions, I can take it up